The role of inflammasome has been receiving a lot of attention in the last, I would say in the last 2-3 years, and particular since its incept and initiation of investigation about the inflammasome that initiated about 5-6 years ago, we made a lot of progress. In particular, try to identify novel mechanisms that allow to identify potential therapeutic intervention. What is the inflammasome? Inflammasome is nothing else that what can be defined the mediator of an innate immune response in the brain. It's been very well characterized, and it appears to have novel aspects that may be associated to the precipitation of certain neurodegenerative disorder, both in Alzheimer's disease and as well as also other neurodegenerative disorders like ALS, and in particular in these last days for potential therapeutic intervention, Parkinson's disease. And the reason is, as eventually we can discuss even further, is because there is quite a bit of nice new science supporting the hypothesis that we might eventually link some mechanism associated with inflammasome with what we call the gut-brain axis that is influenced by microbiome and potential microbiota, and this is new science and opening new therapeutic approaches as well. The cross-talking with inflammasome and gut-brain cross-talking with the periphery is most likely one of the highest topics in understanding the future of the therapeutics I would say, in several neurodegenerative diseases. In particular, the mechanism associated with the role of the peripheral immune system, and the peripheral immune system that is highly connected with the gut system, and is becoming very apparent that the maintenance of a good microbiome, basically a good ecosystem of bacteria in our intestine, are important for the maintenance of a good immune inflammatory activity in the circulation. And there are a lot of cross-talking through eventually through the immune system and probably the gut with the brain through the mechanism that may be related to the inflammasome activation. So the gut may influence the balance of two main systems that are called T regulatory cells, that are also known very well because are also associated with autoimmune disorder like multiple sclerosis. And if indeed the gut is capable to interfere with some peripheral immune system, and then if the peripheral immune system is cross-talking with the inflammasome in the brain, we have a great opportunity to try to better understand how in some way peripheral immune system can talk to the brain, eventually having a global perspective of the global health in neurodegeneration, and not only just what happening in the brain, but also what might eventually happen in the periphery that can promote something that's happening in the brain, and develop new drugs as this one of the most interesting kind of things that maybe we're gonna take care of inflammasome-mediated responses that are initiated in the gut with drug discovery for inflammasome in the brain, when indeed the ecosystem of the bacteria in our intestine is what is initiating almost everything in terms of the cascade of the inflammation in the brain.